Hi, I'm Dr. Mary of Tribu Physical Therapy. I'm based out of here in Tacoma, Washington. And today, this is just going to be kind of a quick and easy tutorial on some self-lymphatic care techniques. We'll go over 6 key areas. We'll go over a couple different tools that can be helpful. And I'll run you through those steps right now. Just some key things to know before we get started. So number one, the lymphatic system is a big part of your immune system. It's a transportation highway for a lot of your immune system cells when you are sick, when you have an injury, to help address that area, attack any viruses or bacteria, or just support the tissue healing or the healing process in an area that is injured. Number two is that most of the lymphatic system sits just below the skin. So you don't need or want a whole lot of pressure when you're working on it. It should be just enough pressure if your hand were to be laying on a certain body part, just enough to kind of stretch the skin slightly. You don't want to push down really hard, otherwise you're just kind of squashing down the structures that we're trying to target and support. So your pressure should be about the weight of what a nickel might be on your skin, or just a very light amount of pressure, with the exception of when we're going through the abdominal area. We've got a lot of lymph nodes in this area, and so there's a deeper lymphatic system that we can do with some different techniques and tools that I'll show you as well. So I always start by telling my folks, think home is where the heart is. That's the direction that you're always going to be directing your massage strokes. So if we're thinking kind of this general area, the lymphatic system has a natural kind of circulation or flow to it. So anything from the head is going to be draining down towards the chest. Anything from the arms is going to be coming kind of up and in towards our heart. Anything in the abdominal area or the legs we're going to try to encourage to come up towards our chest or towards our heart. And so that's where we start. I have folks think of a traffic jam. So using the example of here in Washington, if you're trying to commute from Tacoma up to Seattle in rush hour traffic and there's a traffic jam close to the city, then you don't want to just keep pushing more cars into that traffic jam. You want to try to clear the traffic jam first before you can then kind of travel down that highway a little bit easier, a lot more freely. So same thing with your body. We want to kind of start here. If there's any congestion here, and let's say you've got swelling in your ankle, then we want to make sure that this is clear so that that fluid has a pathway to travel. So we'll start with the first area is going to be kind of neck and collarbones. So I always say don't do this in a restaurant because it kind of looks like the universal sign for choking. But I like to crisscross my hands. You can do one hand at a time, but you're just going to do really light strokes. I'll try not to get the microphone here. You're going to just do really light strokes, just kind of gently stretching the skin, starting kind of on the front to outside area of your neck, and then just down to the top of your collarbones. With any of these, you'll do anywhere between 5 to 10 strokes per location that we're going over. So we just want to make sure that both of these areas are kind of clear and opened up. The nice thing is you can't really mess this up too much. So just do the best you can, and don't worry about trying to get too specific. This is general area of kind of the outer to front edge of the neck, kind of where these neck muscles can tighten up there a little bit, down. That's spot number one. Spot number two, we want to help to drain our head, sinuses, for brain health and brain detox as well. So we've got a spot, that soft spot right behind our earlobes. I'm going to take my finger pads and just very lightly do some taps, or not, I'm sorry, not some taps, some gentle kind of strokes down. Speaking of taps, what I'll also mention is kind of vibration is really helpful and supportive to the lymphatic system. So after you've done a few of your strokes, then you can also just kind of gently tap around that area or tap behind the ears. And you can follow that same process in all of the spots that we'll go over today. So number two, the ears. Number three, we're going to do armpits. So just a kind of a nice kind of scooped hand. You're just going to do a little massage kind of up to that kind of the apex or that deepest part of your armpit. And I'm just kind of scooping gently up and in the direction of kind of up this way towards my heart, 5 to 10 on each side there. And you can just keep the arm relaxed. And we'll go through a little bit of tapping there as well. You can tap the front of the shoulder. So that's spot number three. The abdominal area, we've got a couple different options. So one is just using your hands, and you can just kind of rub more on the surface level. So you can do some belly rubs up and down, side to side. You can do some circles to get more to those deeper lymphatic flow structures. You can do just some really gentle kind of abdominal massage, scooping up. And I try to think of 4 quadrants through the abdominal area. So I just try to hit all of those quadrants a few times. And then of course you can do some belly taps. The other option that you've got for the abdominal area and harnessing the power of our breath and our diaphragm is using something like a Pilates ball. You don't want to inflate it all the way. This is pretty soft, and you could actually even go a lot softer than this so that it looks even more deflated. This is nice and soft where it's not going to be too abrasive or harsh to lay on top of when we're looking to stimulate some of the deeper lymphatic structures. So what I'm going to do with this ball is I'm essentially going to lay down on top of it, and I can arrange so that it's more centered in my abdomen, or I can situate it in any of these 4 quadrants, and you kind of shift around as you go. But basically, you're just going to lay down on top of it. And this should be relaxing. If it's uncomfortable or painful at all, don't do this. But otherwise, you'll just relax your head down, and you're going to breathe into the ball. Feel your belly fill with air. And then you'll let your body kind of melt over top of the ball. If there's an area that's uncomfortable, experiment and play with the positions. You can kind of move off to the side. The diaphragm serves as a pump, so when we incorporate breathing, we're also getting some nice kind of massage and almost like a pump action in through our abdomen. And I would lay and do anywhere between 3 to 5 breaths on the different spots of your abdomen, or you can just stick with the middle or just one side in particular, depending on your comfort level. So Pilates ball, this is a 9-inch Pilates ball. I would actually go, like I said, a little bit softer than this, but that's your option for the abdominal area. The next spot that we'll go over is the front of the groin crease. So here we're just going to do, and anytime you can get directly on skin, that's helpful because it just gets that grip of the skin to get that gentle skin stretch that's going to help to also tug and open up those lymphatic vessels. But you would just do some nice gentle massage strokes kind of up towards your groin. And again, anywhere between 5 to 10. And you can also kind of do that all the way down the whole front of your thigh. Of course, with the arm, when you get to the armpit, you can also follow the same pattern if you want to trace all the way down. And then you can end with some patting over the top of those lymph node areas there. The last spot is going to be behind the knees. So I'm just kind of cupping my hands, and again, just some gentle strokes up behind the crease of the knees. 5 to 10 strokes. You can do a little tap. And if you want to do a little bit of bonus work, you can reverse the order so that you're then retracing your steps after you do this. You can go back up to your groin, back up through the abdominal area, armpits, neck and ears, because as we're getting fluid to move, that's carrying inflammatory chemicals, pain chemicals, toxins. Sometimes we can get kind of a bottleneck effect happening. So we want to kind of make sure that we're clearing out and not overwhelming some of these lymph nodes that we originally opened up at the start. So you can always retrace your steps. The last tool that I want to make sure we go over so that you feel comfortable using one is something called a dry brush. So you can get these at most like Walmart, Target, Amazon, of course, but it's just kind of a natural fiber bristle brush. And you can do the same thing. You might want to get one a little bit smaller and a little bit softer if you're going to use one on your neck. But otherwise, you would follow kind of the same idea. But instead of with the armpits, for example, going right in your armpits, you're going to want to do quick, brisk strokes starting close to your shoulder and then working your way down the length of your arm. You could do the same thing kind of up by that groin crease, and then slowly starting to make your way all the way down the leg. And of course, you can retrace your steps back up. This is a nice tool because it is enough to grip the skin. You get a little bit of exfoliation happening, but this is another option to use instead of your hands. You could also use a dry washcloth. These are techniques that are great to use before, let's say, you get in the shower. Most of us can work that into a routine if you wanted to make it part of your routine to do some self-lymphatic care a couple times a week. You could certainly do a little bit every day, just depending on the amount of body work your body is used to receiving, because you might have a detox reaction. Like if you're doing a full body massage, they'll usually tell you to drink plenty of water, keep your eye out for any detox symptoms, sometimes like a detox headache. So I'd be conservative when you start some of these techniques, but overall, that's kind of the main areas that I coach my patients through. If you have questions, please feel free to reach out and let me know. I'll put my email down in the caption below. And of course, you can always leave some comments as well. But however I can be of service to answer any questions, please feel free to reach out.